Hello, welcome back. This is Saima. If you haven't met me before, in today's video we are going to talk about fake promises. Yeah, so fake promises can be troublesome. This is all we are going to talk about in this video, so stay tuned, watch the video till the end. So we are all human beings. We have a tiny heart there, we have our feelings, and we have all our emotions, and we go through all the stages of our mental health, emotional health, physical, psychological health. So making the fake promises to the patients can put you in trouble. Yeah, why I'm saying that? We as nurses, as care providers, as healthcare workers, we deal with the patients, we deal with live patients. Yeah, and I think giving them false hope or making fake promises is a crime. Why is that? Because if you are telling someone something totally different, if they are going through any condition, in any mental health problem, or they are not going to be discharged from the hospital, or they are not going to be well very soon, and you as a nurse or as a doctor giving them false hope, you will be all right. Yeah, it's okay, it's all right to say that you will be all right, but have you ever thought about it, how fake it sounds? You will be all right, it just sounds fake to me. If we think about it in a normal day-to-day routine, it's okay to say, it's positive to say it will be all right, everything's gonna go fine, don't worry about it too much, just for reassurance purposes. But if you are giving this false hope to a critically ill patient, or you are giving this false hope to a patient who is mental health patient, we don't know what is their cognition like. Okay, so just be mindful of what you say and how you say it, how you word it, right? We as a healthcare professionals, we need to be transparent, we need to be clear in our communication, we just need to be very careful about what we say. Okay, so if I'm talking to a patient who is mental health patient, or a patient who is suicidal, who has suicidal ideations, I need to be careful what I say to them. Okay, and when you go to the patient, you need to know the mental health of the patient, you need to know their trigger factors, what are the things that triggers them to suicide. Or if you are telling a dementia patient or patient with Alzheimer's or any other mental health condition or any psychotic disease, you're telling them that, they ask you, okay nurse, I want to go home, when can I go home? You're gonna go home very soon, maybe tomorrow. And then when tomorrow comes, they are not for discharge. No. So why did you tell them that they're gonna go home tomorrow? Maybe throughout the day, in the morning that day, they'll be asking the nurse, or throughout the night they won't be able to sleep thinking about, oh, they're gonna go tomorrow. So the patients, the clients, they are there in the hospital, they don't have any family members there, they have you, the doctors, nurses, and the healthcare support workers. Other than that, most of the hospitals, the relatives, the patients, and next of kin, they don't stay with the patient, so it's only you who are there with them, and your communication with the patient is very important. Okay, so if you talk to the patient, just be mindful of what you say. Now, why I said that it is a crime, it's a crime in terms of breaking their trust, it can break their trust. Yeah, and also it's a false hope, it's misleading to the patient. Yeah, it's a misleading thing to say in terms of their treatment plan as well, right? Maybe they are not in the state of being discharged, or maybe they need to stay in the hospital for a few more days. Yeah, if the patient is confused, it doesn't mean that you can tell them anything. Okay, most of the patients with dementia, they come to the hospital to get well. When they are back to their baseline, we send them back home, or to the nursing homes or to the care homes. yeah, but also we are there to bring them back to their baseline. If they have dementia, that's not the end of the world. They have their own routine to follow. They have their own schedule in their day-to-day routine. They get up in the morning, same like us, as all we do. They have their breakfast, they may do laundering, cooking, everything they can do. It's only that they have some symptoms. Yeah. So why I'm saying is because it recently happened one of my colleague. So that, okay, let me just tell you without sharing the confidential information. So one of my colleagues, she spoke to one of the next of kin of the patient about some medications, because a lot of patients here, they are taking so many opioids. Yeah. So if they are not taking them regularly, sometimes the doctors, they stop it. This can also be the results of their blood tests. If they have any problems with their liver function test, with their renal function test, because the opioids, they usually affect on your kidneys. They can also make you constipated. So they outweigh the benefits and the disadvantages. Yeah. So it depends on the doctor's prescription whether they should go home with opioids, with pain relief medications, or controlled drugs or not. Okay, so it's not your job to decide what painkillers the patient should be on. You can it's the doctor's responsibility to prescribe according to the condition of the patient, according to the diagnosis of the patient, allergic status of the patient. So it's not a nurse's responsibility. Yeah. So my colleague, she spoke to a next of kin. The next of kin wanted to have some pain relief. So when the patient goes home, she's very settled, she's pain free. So she said, okay, I'll speak to the doctor and I'll ask the doctor to write the painkillers for you, okay, for your patient. Then they both agreed, okay, tomorrow, because it was late evening already. So in some hospitals, the doctors stay mostly till 6, and then after that they have a bleep. So if there is an emergency, you can bleep the doctors in the wards. So you can bleep the doctor, and the doctor comes and talk to if there is any prescription or anything special. They can just do the job. But regular duties, they usually are till 6 or sometimes till 4 o'clock. So the doctor wasn't available at that time. So she spoke to the next of kin. Next of kin said, oh, she only wants her mom to go home with these pain reliefs, because otherwise she'll be too much troublesome at home. She will be in pain, she won't be able to walk around, things like that. So my colleague, she just said, okay, I'll speak to the doctor, maybe the doctor can prescribe the painkiller. And then the patient was for discharge the next day. And what happened was, when the doctor came this morning, the next morning, she said, since the patient is not taking any pain reliefs in the morning apart from paracetamol and codeine, she's not happy to send the patient home with morphine, with a controlled drug. Yeah, so I called the family. I told them that I'm sorry, but the doctor said she's not prescribing morphine because she's not getting any PRNs throughout the admission in the hospital, and her pain was well settled with paracetamol and codeine. So that next of kin wasn't happy. She was not happy at all with me saying that. So I said, I'm sorry, it's not in my hands. I've spoken to the doctors and the pharmacist, and the doctors is not happy to prescribe this control medication because it can affect her kidneys. It can, whatever the consequences are. So I didn't mention anything about the side effects, thinking that the doctor can explain it better, or I don't want to just say the things, because we know that, sorry, the morphine and all the opioids, they can cause kidney damage. We know, but the families, sometimes they don't understand it. So I asked the doctor, I said, okay, if you have more concerns about the medication prescription, I'll ask the doctor to give you a call. So I asked one of the doctors to give her a call, and she wasn't happy with the doctor as well, because doctor said she is not going to prescribe since patient is not taking any pain relief, any stronger pain relief in the hospital, and she's happy with paracetamol and codeine. So the patient relative, she just shouted at the doctor continuously, even though it's doctor's decision whether she should go home with the pain relief or not. So the whole problem, why it started, because we, my colleagues on the previous shift, one of the colleagues agreed to the next of kin, promised to the next of kin, okay, the doctor will write it for you. Okay, so I'm just telling you for my experience, whenever you say something to the patient's family, just be sure it's correct, and you are not just making it up. So how could you say that? You can say, I'm not sure about the medication prescription because I don't prescribe. I can check in the discharge letter whether the doctor has written it or not. She has not written it, but we will speak to the doctor if it's required. But if it's required, or according to the medical condition of the patient, if it's needed, I'll ask the doctor to have a look on the prescription. Okay, so we are not promising anything. There is a if word there. Yeah, and also not only this, there are some other things also, like if you don't know about the medical condition of the patient and you say something to the relative just in general, okay, it can put you in trouble as well. So just be careful what you say. Yeah, if you don't know about any medical condition of that particular patient, you cannot comment on that, and you're not sure, speak to your seniors. Maybe your senior, they can speak to the next of kin. And so with this scenario, what happened, the next of kin was not happy, the patient wasn't happy, so they put an official complaint that we didn't give them enough pain relief, and yeah, it got into a big trouble. So all the next of kin was saying, because they promised me yesterday that it will be all sorted, and this patient, my mom, she will go home with all the required medication that I am asking for. Okay, so now the families, they cannot ask. I know they may know the patient better than us, but they can, if the doctor is saying no to them, if the doctor is saying that she's not happy to prescribe this medication, then we nurses, we can't do anything, can we? All right, so that's all, to be honest. Just wanted to say to you that because we have that daily interaction with the patient, so giving them false hope can lead to broken trust, and it can also mislead them for your treatment plans. And with the next of kin, with the family members also, sometimes we need to be advocate of the patient. We just need to be very mindful of what we say. Always check in the system, always check on the patient medical notes, what is patient medical condition, is it okay for me to say these words to them? Because you are there as a professional, you are there as a nurse, and you are the one mostly there present when the relatives or when any family member comes to see the patient. Most of the times the doctors or your seniors are not there. So just be very careful in whatever you say, and also keep the communication very clear in between you, your patients, and the families, because we are there to build relationship with the patient, to build good relationship and good rapport with the patient, not to break their trust. And I think we are the backbone of the hospital. So yes, that's all, to be honest. I'll see you soon in the next video. Till then, take care. Bye bye. God bless you all.